Hello, my name is George. I'm going to be your nurse today. Could you tell me your name and date of birth? I'm checking their name band. I've performed hand hygiene, and I'm coming back to the patient. Do you have any allergies to any medications? I'm checking the MAR to make sure that that they have no known allergies to any medications that I could possibly be giving them. I'm making sure that it's the right patient, the right drug, the right dose, at the right time, and at the right route. And next, I'm making sure that the medications that I am giving them today won't be contraindicated with a nasogastric tube. Medications like heavily very oily medications, they could get stuck in the syringe or the tubing. Coated medications, they're not supposed to be crushed for the purpose that once it's released in the body, it'll open up itself, so it could it wouldn't metabolize the same way. And then sustained release tablets, because again, they're supposed to be metabolized in the body. They're not supposed to be crushed or messed with. So for this procedure, we want the patient in a high Fowler's position, 30 to 45 degrees sitting up. And I'm gonna put on my gloves. So before we do anything with medication, what we want to do first is we would review the X-ray of the chest to make sure that it's in the right placement, that it's in the stomach, and then next we would use our syringe. For this purpose, you wouldn't use this, but for this purpose, we'll use it. What we're going to do is we're going to connect the syringe to the hose, or the piece at the end, and then we're going to aspirate for stomach contents, because you're going to do it until there's no return back. So if you keep going and you stop at 50 and there's no more to take, we would put it into whatever container you're using. You wouldn't use this counter, but we'll use it for this purpose. You would put it in, put the contents in there, and then you would test the stomach contents to make sure that the pH is between 1 and 5.5. And if everything checks out, the pH is good, the X-ray shows that the tubing is in the stomach, it's placed in the right spot, we're going to go ahead with giving the medications. For pill medications, we would crush it to a fine powder, and then we would crush it to a fine powder, and then we would administer it with water, usually 20 milliliters of water. So you would put the powder mixture with the water into the syringe. You have it plugged in, you have it kinked. So then you would put the medication with the water in here, raise it up high, let it drain down, and then you would flush it, kink it, put water in there, flush any residual. If they're getting more than one medication, say the second medication is liquid, you would do the same thing that you did with the powder. You would put it with water, usually 20 milliliters, put it in there, let it flow, and then kink it up, and then flush it with regular water, and then let it flow again. You would put a clean cap at the end of the tubing. You would make sure that the patient isn't having any side effects of the medication, whatever you administered. You would check to make sure that they aren't experiencing any side effects, any nausea, vomiting, diarrhea. You would leave them in this position for 30 minutes. As with any tubing, you don't want them to go lying flat in a supine position. I would give them the call bell. I would tell them to ring me if they were feeling any discomfort, and like I said, any nausea, vomiting, diarrhea. I would perform hand hygiene, and I would document the medication that I gave them at the time that it was, at whatever time it was. I would document that. All right.